So today we're just going to do a head-to-toe assessment to assess your general well-being.
Okay.
See if you're doing okay. I'm going to clean my stethoscope first. Okay, so first we're just going to do your vital signs. I'll start with your blood pressure. Do you have a preference on what?
Let's do this one.
Okay. Sorry. If you want to just hold that for me, that'd be awesome. Okay. Alright, so it's about 115 over 75. Okay, and I'm going to go ahead and take your temperature in your ear. Okay, 97.3. Looks good. Okay, and then I'm going to go ahead and feel your pulse. Okay, so your pulse is 64 and a respiratory rate of 16. Okay, and then on a scale of 1 to 10, what would you rate your pain today?
Probably a 0.
A 0, so that's good. Okay, so I'm just going to assess your general appearance. Everything looks good. Good skin color. Do you know what year it is?
2021.
Great, and do you know where you are right now?
I'm in the hospital.
Perfect, so good level of consciousness. Work of breathing is good. No signs of distress. No notable deformities or bleeding. You have good affect. Good odor, grooming, and mobility, so you look good and healthy. So we're going to go ahead and do your cranial nerve assessment. So do you have a hard time smelling, or can you smell things pretty easily?
I can smell things good.
Perfect. Okay. And then we're going to go ahead and test your optic nerve.
Okay.
So I'm just going to have you close one eye, and then tell me when you see my finger. Okay, and then we'll do the same thing with the other eye. Okay. All right, and then do you have any problems like seeing? Do you have any blurry vision or anything like that?
No.
Okay, awesome. And then I'm going to have you follow this pen light for me. So don't move your head, just follow it with your eyes. Good. Okay. So now I'll just have you look straight forward for me. Okay, so your pupils did constrict, which is good. That's what we're wanting. And I don't see any sign of your eyelids drooping, so that is good. All right, can I have you take off your mask for me? All right, can I have you clench your jaw? Awesome. And then go ahead and smile for me. Good. And frown. Okay, and then I'm gonna go ahead and have you close your eyes, and I'm gonna kind of gently tap your face with this and tell me if it's soft or sharp, okay?
Okay.
Soft. Good. Hard. Good. Soft. 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 it's yeah. You did great. Okay. Can you lift your eyebrows for me?
Yeah.
Okay, now clench your eyes. Shut them tight. Yeah. Puff your cheeks. Good. Okay. And your face looks really symmetrical. Everything looks great. And I'm gonna go ahead and test your ears. So can you hear this?
Mhm.
How about this?
Yep.
Perfect. Okay. Now, can you say ah?
Ah.
Good. Okay. And I'm just gonna assess inside your mouth really quick here. Good. So the uvula is up and the palate's down. Can you move your tongue for me? Okay. Good. And stick it out. Good. Okay. Everything looks good there. All right. Now I'm gonna have you turn your head towards my hand. Okay. Good. And this way. Perfect. Okay. Now I'm gonna have you shrug your shoulders. Awesome. Now try again with resistance. Perfect. Okay. Sorry, I'll have you take your mask off one more time. Sorry. Can you stick out your tongue for me again? Okay, the midline is good. Everything looks healthy and good. There. Okay, now I'm going to go ahead and assess your skin, hair, and nails. So your skin looks good. The color's good. Integrity is good. There's no sign of impaired skin integrity at all. Texture's good. Temperature is good. Turgor's good. And yeah, I don't see any areas of impaired integrity. There's no sign of blanching or any tenderness. Do you have any pain with your skin or any abnormal things that you noticed?
No.
Okay. And I'm gonna go ahead and feel your scalp. Any pain or tenderness?
No.
Okay, good. So your hair looks good and healthy. Your scalp is good. And then can I see your nails? Beautiful. Okay, they look great. Now I'm just gonna inspect your head, neck, and lymphatic system now. So your facial features look great. No signs of edema or facies. And I'm just gonna assess the position of your trachea, and it's good. And then I'm gonna assess your jugular veins. Okay, no signs of distension there. And then your thyroid, if I'll have you face this way. Okay, I'm gonna go ahead and swallow for me. Okay, perfect. Okay, so thyroid seems great. I'm gonna go ahead and palpate your lymph nodes. Tell me if you have any pain at all. No? Okay. All right. And then I will palpate your temporal arteries. Okay, good. Seems strong and good. All right, so I'm going to go ahead and inspect your eyes. Sclera is good. And your conjunctiva. I don't see any drainage at all. And then I already assessed for the constriction of your pupils, so you look great. There's no sign of nystagmus or edema. So, and do you have any pain with your eyes ever, or everything's good? Okay. I'm gonna go ahead and inspect your ears. So the symmetry looks good. They're nice and even. Configuration is good. Position is perfect. Alignment is good. And then any tenderness when I touch. Okay, good. And then I'm just gonna note for any drainage. And there's none. Okay. I'm gonna go ahead and inspect your nose so you can take your mask off. Okay, I'll have you plug one nostril and breathe. Okay, good. And then do the same on this side. Any problems or difficulty? Perfect. I'm just going to inspect for... Awesome. Everything looks good and clear, and there's no drainage or odors at all. Okay, now I'm going to inspect your mouth. So your lips look good, good color, and I'll have you open up again. Okay, mucosa looks good and healthy. It's a good color. Teeth and gums look good. The tongue is good, and we assessed it earlier with the nerves. And can you say ah again for me? Good. And do you have any problems with taste? You can taste most things. Okay, good. Now I'm gonna go ahead and palpate your carotid artery. Good. Good. I'll make sure to do that one at a time. Okay, now I'm gonna go ahead and listen to your lungs. breath for me. Good, and again. Okay. Okay, go ahead. And again. Perfect. Now I'm going to go ahead and do on your back in 6 different locations. Okay, go ahead and breathe in. Good. Okay, so your lungs sound really healthy and good. That's always a good thing. Okay, so it's clear bilaterally on all sections. The rate is good, the depth is great, rhythm is great, and pattern as well. And you don't have, your work of breathing is good, so it doesn't require a lot of energy for you to do that. So, your chest rise is great during your respirations. And then, do you have any tenderness when I press right here? Nothing? Okay, what about right here? No tenderness at all? Okay, perfect. And there's no retractions or accessory muscle use, so that's good. Okay, now I'm going to go ahead, put my hands on your back, and I want you to say 99.
99.
Okay, say it again.
99.
And again.
99.
Good. Perfect. Okay, now I'm going to go ahead and percuss your lungs on your back. So just relax. Okay, so everything seems good. Like that. Okay, so your lungs are healthy and good to go. So we're going to go ahead and move on to the heart. Okay. Okay, I'll send you down here. Okay, good. So your heart is good. It sounds good and healthy. I assessed S1 and S2. The rate and rhythm are good and strong. There's no sign of murmurs. I didn't note that at all. No irregularities with your rate, rhythm, or sound. So you seem great and healthy. Okay, so I'm going to go ahead and inspect your abdomen. And everything looks good there. I'm going to listen to your bowel sounds. That's okay. Okay, good. You sound great. All right, and I'm going to go ahead and palpate. Tell me if you feel any pain or tenderness, okay? Any pain? No. Perfect. Good. Okay. Are there any other irregularities with your abdomen that you can think of? Okay, and then when was your last bowel movement?
Last night.
Good. And any difficulty there or?
No.
Awesome. And are they pretty regular then?
Yeah.
Good. Do you have any ulcers or dysphagia, like difficulty swallowing?
No.
Good. What about heartburn or nausea, vomiting?
No.
What about like passing gas? It's good?
Yeah.
Okay, that's good. Constipation, diarrhea, or hemorrhoids, any problems with those?
No.
Good. Awesome. And then I would feel the femoral pulse, which is like around this area. Okay. And then what is your height?
5'5".
Awesome. And your weight?
115.
Perfect. And your nutritional status?
Good.
Good.
Yeah.
And do you have a pretty good appetite?
Mhm.
Awesome. And can you tell me what you ate in the last 24 hours?
So for lunch I had a PB&J with some fruit snacks and a granola bar. For breakfast I had a protein shake, and for dinner I had a pasta, I guess.
Good. Perfect. Sounds great. And then with your urination, do you have any pain or difficulty there?
No.
Okay. And what's the color of your urine usually?
Light yellow.
Good, that's perfect. And then, is it clear usually? Okay, good. And then, when was your last menstrual cycle? Do you remember?
A couple of weeks ago.
Okay, and are they pretty regular?
Yeah.
Okay, awesome. And going to assess your arm strength. So go ahead and squeeze my fingers for me. Good, and push away, and then pull. Good. And then I'm gonna go ahead and assess your radial pulses again. I'll do it for 15 seconds, and like I did earlier. And they seem strong and good and healthy. Cap refill, I'll have you stick out your fingers for me. Good, so it's 2 seconds, which is perfectly normal. And then your hands, the temperature is good, and there's no sign of edema at all. Alright. Okay, now we're going to go ahead and move to your legs. So I'll have you stand up for me. We're going to, I'll have you bring your leg out like that, and back in, and then other side. Good, okay. And then I'll have you sit down. And then I'll have you extend your knee and flex it, and same thing on the other side. Perfect, okay. And then I'll have you push up with your feet and down. Good. Okay. All right, and then can you take off your shoes for me? And your socks too, that'd be great. I like your socks.
Thank you. Sorry about my spray tan toes.
No, they look great. Okay. So, I'm going to assess your posterior tibial pulse. And I'll do this for 15 seconds. Okay, so the pulse strength is strong and good. And they seem pretty regular, and your cap refill, good, so about 2 seconds there. And then the temperature is good, and there's no signs of edema, so everything looks healthy there. Okay, and then I'm just going to go ahead and feel your pedal pulse. Good, and those are strong as well. Okay. All right. So the pedal pulse was strong and regular. You can put your shoes back on. Okay, so we're almost done. I just noticed that your mobility and gait are good. Can I have you stand up and walk to the desk and back to the bed? Good. Perfect. So your gait is great. You have good coordination and good posture. And then can I have you put your feet together and close your eyes? Great. You passed the Robert test. So you have good balance. So that's good. Now I'm going to have you take your finger and touch your nose and touch my finger as fast as you can. Just do that as many times as you can. Good. Perfect. All right. And then I will have you just walk. It's called the tandem walk. So put your heel to your toe and just walk in a straight line if you can. Perfect. Okay, good. And then if I could get you to put your heel to your shin and both feet. Good. Perfect. Okay, you can sit back down now. Okay, so now I'm going to go ahead and test your knee reflex. So I'll just have you dangle your legs for me. Good. Awesome. Okay. So everything looks good there. So overall, everything looks great. You seem very healthy, and again, we assessed your pain on your face earlier, and you can feel everything pretty well. And I provided privacy for the patient throughout the entire exam. Okay, so here's your call out if you need anything, and I will be back later to check on you, okay?
Sounds good.
All right. Right hand hygiene. All right, and I will go ahead and document all my findings in the chart.